Good morning, everyone. My name is Beth White, and I am the president and CEO here at the Coalition. Welcome to the regularly scheduled Coffee with the Coalition for April. It is Sexual Assault Awareness Month. We are on the 21st day of the month. We're making it through. It's been a great month, and we're excited to celebrate a lot that's been going on here in Indiana. But today, for our Coffee with the Coalition, we are going to take a step out to a broader view, which is a national view. And I am really honored and delighted to introduce our guest who is with us this morning. Terri Poore is the policy director at the National Alliance to End Sexual Violence. And in the work that we do here at the Coalition, we are one of many coalitions around the country. Every state, some of our tribal governments, and most of our territories and protectorates have coalitions. The coalition movement is robust, and the National Alliance to End Sexual Violence is our advisor, our umbrella, our policy arm, our voice, not only in Washington, but around the country for various issues relating to policy. And Terri is such an amazing resource, and I'm excited to hear from her this morning. She is a person I've gotten to know in the role here in the coalition, and I'm again just delighted to have her with us today. Terri is one of those people who works at the highest levels of this movement, but started at the very basic levels of our movement. Terri is currently, as I said, the policy director. She worked at the Resource Sharing Project as well. She was 13 years as the policy director of the Florida Council on Sexual Violence. So she worked at the coalition level. She was the director of training and technical assistance, and she also was a program coordinator at a rape crisis center in North Florida. So she worked at the coalition level in Florida. She worked at a rape crisis center in the state of Florida as well, but she started her career as a victim advocate in the state's attorney's office. So she started at the very basic level of meeting victims where they are every single day, which is something that I think some of you on the call also do. She worked also on her master's at Florida State University in social work, and she has a BA in sociology from Loyola in New Orleans. So Terri, I'm just delighted, as I said, to have you with us this morning. Thank you for joining us. I know that you always have important information to share and also a really, really broad perspective. So Terri Poore, welcome to the Indiana Coffee with the Coalition this morning. And it is now, I think we've got your slides ready to go, so you can take it away.
Thank you so much, Beth. I so appreciate that introduction, and to be with you all doing this work in Indiana today. Know that you are represented so well by the Indiana Coalition to End Sexual Assault, such an important partnership for us. And we know you are doing such important work in your communities every day to support survivors and end sexual violence. And we're so grateful. And as Beth said, I started, actually my first position in this work was as a volunteer in a rape crisis center. So I understand how challenging the work is. I understand how important the work is, and that I try to let that inform me every day. But I so appreciate you being here. Hopefully it'll be valuable, and we'll just talk some about like what we're working on in terms of federal funding that benefits local programs and prevention. I'll tell you just a little bit about the National Alliance to End Sexual Violence. We definitely focus on policy, and our policy work is really through the state, territorial, and tribal coalitions, but to the local programs that serve survivors and are prevention leaders in their community. And I know many of us in this work have small but mighty teams. We consider ourselves a small but mighty team, helmed by Monica Johnson-Hostler, who's our president and CEO, and then Ellen Fern, who Beth and Michael see a lot because she is our policy consultant and provides a lot of federal updates. Brittany works on our policy work, and Camille and Maureen do so much of our programmatic and support work, just do lots of amazing work. A lot of the things you'll see today are due to a lot of their hard work. Okay, so I thought we'd start with a little bit of recent data. Hopefully some of these things you may have already heard about or seen, but just to level set, I thought I'd talk about our Rape Crisis Center survey data, which you may well have responded to, and if so, thank you so much. The National Intimate Partner in Sexual Violence recent data, talk through a few advocacy basics, and then talk you specifically through what our advocacy requests are for this year, and then hopefully have some time for Q&A. But I wanted to start with our 2025 Rape Crisis Center survey. As I said, many of you may have responded to it. It's an internet-based survey, and we had 449 completed responses this year. That's a pretty good participation rate for us across 41 states and the District of Columbia. So let's get into those results a little bit on that survey. So what we found was that almost half of programs experienced a decrease in funding for direct services. Half did experience a decrease in funding for prevention, and a little over half experienced a decrease in staffing over the past year. So we know that you all are struggling in many ways, and we know some of the dynamics that are fueling that struggle as well. At the same time, we know that the need is increasing. And this is data we use every day in our conversations with your members of Congress, with our members of Congress, to really paint the picture of what rape crisis centers are experiencing. And we use rape crisis center as a broad term. We know many of you are in dual programs or multi-service agencies or child advocacy centers that sexual assault services are provided in a wide variety of formats. But we often talk about rape crisis centers because we feel like that allows people to picture most clearly the work, the important work that you do every day. And you'll see in these slides, but also in the infographic that's linked in that advocacy page I shared, that we're really pulling out stories from the field too. And we really focused on that during Sexual Assault Awareness Month in our social media. If you don't follow us on Instagram and LinkedIn and Facebook, we would welcome you to do that. And we've been sharing a lot of those stories from the field, like this Pennsylvania quote that's on the slide, in our social media this month during Sexual Assault Awareness Month, to really elevate the work that you're doing in your communities. So we saw 60% of programs experience an increase in demand, almost 60% also an increase for prevention. And then one of the things that really stood out in this survey is that 70% of programs saw an increased demand for housing services. So we are really trying to help Congress understand the intersections between sexual assault and the housing needs of survivors, because that came out so clearly in this survey. In fact, housing came out in the survey as the #1 unmet need of survivors of sexual assault. But we also found that a third of programs had a waiting list for mental health counseling and therapy services. And actually, and we track this statistic over the years and it doesn't change much, but it's particularly concerning to me because we know we've learned so much about trauma and how to help survivors of trauma heal. And yet we know that so many people don't have access to those cutting edge therapies and supports, and that 50% of our programs don't have a full-time therapist on staff, which is something that I really think all programs need. That's the summary of our survey that we do every year, where we ask you all to respond. And then through the CDC, they do the National Intimate Partner and Sexual Violence Survey, and I shared that link to that brief in the chat a few minutes ago. And we really think this is the important national data about the prevalence of sexual violence. And they released a new data brief on sexual violence in, I think it was February. Sorry, blanking on that. It's probably on my slide somewhere. But anyway, it's recent data, and it's data from that they gathered in 2023 and 2024. And it found that nearly half of women and more than 1 in 6 men in the United States experience some form of contact sexual violence in their lifetime. You'll also see that there are numbers in the survey about people that have experienced sexual violence in the past year. And approximately 1 in 3 women experience verbal sexual harassment in the workplace, and 1 in 14 men. So importantly, looking at settings where experiences of sexual violence might occur. Interestingly, with NAESV, this most recent data brief, they included state level data. And so that brief will include information about Indiana specifically. Now, one of the things, this is also marks the release of a new approach to collecting data for NAESV. It's been modernized. What they were finding, and this is across issue areas, that responses to phone type surveys have been decreasing over time. So they really changed their approach to gathering the data. So what that means is we can't compare the data across different years of NAESV. And we also can't compare data between states, but it does give us a snapshot of the problem that I think is an important part of painting the picture for policy. Okay, next slide. Okay, so that was sort of our data, the level setting about the problem. And then I always think it's useful, folks are thinking about policy, we're talking about advocacy, to talk through a little bit some of the frequent questions we get about, like, hey, I want to do advocacy, I want to be involved in policy, but, I'm a nonprofit. I want to be very careful about that. And especially in this environment, that is super important. And so just a little bit about the differences between lobbying versus education. So what we know is that you can educate policymakers. That is not lobbying, where you're talking about what your program does. You're talking about what survivors need. What separates lobbying from education is when you're making that specific request to a policymaker to take a position on legislation or to increase funding for a program. And you'll see in a minute, we're going to talk through some very specific requests. Make those requests, or when you ask somebody else to make those requests, that is lobbying. Now, we talked about, you're kind of very open with educating policymakers, and nonprofits can lobby. It's appropriate in many cases to do so, but nonprofits can only use a portion of their budget for lobbying. And importantly, when we go to the next slide, federal funds can never be used for lobbying. So anytime you're making a specific ask of a policymaker to increase funding, to fund a program, to support a bill, you can't be doing that on federal dollars. And 501c3s can also never engage in political campaigns, so nonprofits can't take a position on a candidate, but they can engage in elections in nonpartisan ways. So for example, your program could host, have everybody running for mayor in your city. If you invite everybody running to talk about, here's what I think about gender-based violence, here is what I would support. If you're inviting every candidate, you can do that, and you can engage in efforts around ballot measures. And you are free in your own personal time to take time off work and go meet with your elected officials in your own personal capacity and tell them what you care about. That is absolutely appropriate. Okay, and so we're focused today mostly on federal policy advocacy, and especially around appropriations, which is funding. But there's a lot of different types of advocacy, and I know there's legislative advocacy that can happen at a local level, and I know you all are involved in state. The Indiana Coalition to End Sexual Assault is involved in policy at the state legislature level. But the systems level advocacy you do is really, really important too, with housing providers in your community, with the sexual assault response teams are also advocacy entities. And super important. And then there's administrative advocacy, which is your work with your mayor's office, with your governor's office, our work with the Department of Justice, with the CDC, and with state agencies. So there's many ways to be involved in advocacy. And so thinking more broadly than just being involved with Congress. So I'm curious, and I meant to set this up as a poll and then I forgot, but please share with me in the chat if you've ever met with a local policymaker to discuss sexual assault services and prevention. I'm curious what your experience with that has been. And if you're in listening mode now, we can talk about this more later too, but I welcome your participation and questions in the chat. And so what I really want to say today is just to really encourage you to think of yourself, because you are the expert in sexual assault services and prevention, and your expertise is important to policymakers. So a lot of times I think we can feel like, with people in authority, with people in leadership, with people who have a lot of situational power, like, oh, I feel nervous to talk to them. But remember, they aren't an expert in sexual assault. You are. And so they need the information you have. So I really want to empower you to feel like the information you have is super important to share. Your experiences, your stories, they're so important. We share the data because data is super important to share with policymakers, but the stories, the examples of how you've impacted a survivor's life, the examples of, you were in a school talking about prevention and you saw a light bulb go off for a student about consent. Those things are really evocative and powerful for policymakers to hear and understand about our work. And that with policymakers, it's really about relationship building. Yes, we, at them on social media about specific issues we're working on, but it's every bit as important to invite them to an event you're having, to build that relationship with them over time. What we really want to do is, with some of our policymakers, have them think of us as the experts they want to call when they have a question. Like, there's, sexual violence is in the media every day right now. And it's really important that policymakers think of us as the people that they want to talk to. So there's a lot of different ways to engage policymakers. I mean, you can offer a tour of your program. You can invite them to speak at an event that you're having. As we talked about before, you can do a candidate forum where you invite all the candidates to come and talk. You could host a listening session with your staff and board with a policymaker. You can also go to their events, whether, if they're at a town hall meeting, and provide testimony about your program. Sometimes they have community events where you can show up and, rub elbows and have a little chit chat. They can also be volunteers, and you can also, as I mentioned before, use social media to create awareness of your issues. So those are all ways to engage them. I've just hit a few highlights from our advocacy toolkit in this briefing today, but I do want to share with you that we have in both English and Spanish an advocacy toolkit. That there's the QR code here, but in the first link I shared too, that page has a link directly to these toolkits too, in case those are useful to you. They're go into more detail on advocacy. And I see Elizabeth shared in the chat that she regularly engages with policymakers for your programs and partners. That's wonderful. So glad to hear that, Elizabeth. Okay, so now we're going to jump into the nitty-gritty of some of the key federal issues that the National Alliance to End Sexual Violence is focused on for this year. So we're going to talk through all of these issues in a little bit more detail. So one program that's really important to us and we know is really important to you is the Victims of Crime Act, VOCA. The Crime Victims Fund, the CVF, is such an important funding source for local sexual assault services. And we know we've all been working really hard over the past years about the health of the Crime Victims Fund. It hasn't been particularly healthy. We've seen deposits into the Crime Victims Fund go down. Really importantly, this is a non-taxpayer source of funding for sexual assault services. VOCA is funded by fines on federal offenses. And we know that it's so important for sexual assault programs, but it also funds all different crime victim services. We've been really glad that the Crime Victims Fund release, so its money released from the fund, has held steady over the past couple years. We're asking for an even number in FY27. We're in our fiscal year 27 requests. Technically, we're in federal fiscal year 26 right now. We're a little over halfway through. The federal fiscal year runs from October 1st to September 30th each year. So we're living in federal fiscal year FY26 right now, but we are advocating around FY27 funding, which ostensibly would begin next October 1st, but we know we're coming up on the midterm election, so we expect, as we've seen in past years, that Congress may not complete its appropriations work, and so they'll have to pass a continuing resolution, or CR. So we expect that. Okay, so importantly, we keep looking at the issue of the health of the Crime Victims Fund, and so we advocate for funding for VOCA, but we also have legislation, the Crime Victims Fund Stabilization Act, and that has passed the House, which is amazing. You all may have been working on this. I know a lot of us have been working on it. I'll share in the chat, maybe toward the end, I'll have to go find the link. But we have a social media toolkit for this week around the Crime Victims Fund Stabilization Act. We're really focused on the Senate and Senate leadership specifically right now because it's passed the House with broad bipartisan support. There was it might be on my slide, but there was over 330 bipartisan co-sponsors in the House, and we're up to 20-ish co-sponsors in the Senate. So we're getting a lot of co-sponsors, which is really good. But we really need some, this is one of the things we're really working to push over the finish line because we think this will help a lot with the health of the Crime Victims Fund. So what this bill would do is take money from the False Claims Act. So people that defraud the government have to pay into the False Act, and the False Claims Act has to pay out whistleblowers and agencies for the harm that has been caused to them. But then there's money that's left over that goes to the Treasury. And what the Crime Victims Fund Stabilization Act says is, hey, the Crime Victims Fund is not very healthy, and we really all depend on it. And so for the next several years, take that money that's going to the Treasury from the False Claims Act and put that in the Crime Victims Fund to try and get us into a healthier place. And so that's the legislation, and we're pushing really hard to try to get this through the Senate. So really important work to do. The other thing, and we start kind of on the Department of Justice side of the work in these slides, and then we get more into the HHS and other agencies. But the other really important priority for us that's in the Violence Against Women Act space, in the Office on Violence Against Women at the Department of Justice, is the Sexual Assault Services Program, really important formula funding that comes down to states and local programs. And we've seen some good incremental increases to this program. It's authorized in the Violence Against Women Act at $100 million, and we are asking for full funding for that program because of the data I shared early in this presentation about the needs of rape crisis centers. So we're asking always for an increase in SASP. And then I want to just touch for a minute on some of the things we're seeing with the administration at the Department of Justice. Really importantly, the president's budget for the second year now has recommended, and we know DOJ is moving forward with this plan to consolidate the Office on Violence Against Women, the COPS program, into the Office of Justice programs. And this is not something that the National Alliance to End Sexual Violence supports. There's really strong statutory authority for the Office on Violence Against Women to be its own entity. And so we don't support consolidation. We've been pushing back about it. But we do feel like the Department of Justice is moving forward. We're also concerned that some of the funding from FY25 discretionary grants has not gone out to the field yet. The Office on Violence Against Women has some formula grant programs like SASP that we just talked about that goes out to every state, also the STOP program. Those funds are out. Some of the bigger discretionary grant programs like rural and legal assistance, those are out, but there's a lot of other discretionary grants within the Violence Against Women Act where the FY25 funds have not gone out yet. And that's been an advocacy point for us. It's been a point of concern. And then we're also concerned about the FY26 notices of funding opportunity that should be going out soon. There's a lot of changes happening around this consolidation and delays. And, we're just watching this really carefully. It is a source of concern and something that we're paying close attention to. So those are the sort of the highlights of what we're looking at with the Department of Justice, highlights or lowlights, depending on how you're looking at it both, with the Department of Justice. And then we have some really important priorities over on the HHS side of the budget as well, including the Rape Prevention and Education Program, or RPE, which sits at CDC, but this program is also reauthorized in the Violence Against Women Act. And RPE is also authorized at $100 million. It's been the past couple years at $61.75 million. And we'd like to see it at $100 million. We know this program funds such important primary prevention efforts in the community. So a very important priority of ours. And we'll go on to the next slide, but I'll kind of harken back to RPE on another issue in a minute. We also feel like the federal government should be doing more to support the public health response to sexual assault. We know a lot has been done on the justice side of things, but we know that there are strong linkages between chronic health and sexual violence, between the behavioral health needs of survivors around mental health care, substance use care, all those sorts of really important tie-ins, and that not enough has been done there. We really feel like the HHS, the Office of Family Violence Prevention and Services, should have funds to provide to programs, to provide direct services to survivors, but also to build those partnerships between local sexual assault programs and behavioral health, healthcare systems, early childhood programs, all those pieces, that there's a lot more that can be done there. And so we have a $100 million request for OFIP as part of our priorities this year. So we have the $100 million appropriations request at OFIPS, but then we have standalone legislation, HIPSA, or the Healing Partnerships for Survivors Act, which is a bipartisan, bicameral legislation that's been introduced in Congress to create a pilot project to do this work of helping build partnerships between local sexual assault programs, behavioral health, physical health networks, all the different sort of public health approaches to issues in our communities to really support sexual assault programs being funded to help develop those networks. And so we haven't seen a lot of movement on this legislation, but we really feel like it's an important way to discuss the needs of sexual assault survivors. Okay, so what are we watching in terms of the administration around HHS? The president's budget for the second year in a row recommended consolidating the rape prevention and education program. You're seeing there's this theme around consolidation. The RPE program and the domestic violence prevention program, Delta, into their new administration for a healthy America. So just to step back a minute, I want to remind folks that the president's budget is a recommendation. It's a blueprint, but Congress holds the power of the purse. So, the president's budget, sometimes people will say like in and out of administration, sometimes people say, oh, the president's budget's DOA, that Congress does not have to follow the president's budget. So I don't want to suggest that these ideas necessarily will come to fruition, although they are very concerning. This proposal to consolidate RPE and Delta and several other small programs into one program and then cut it in half in terms of the amount of funding was in the president's budget last year too. And we were able to fight that off in Congress. We have a lot of good support in Congress. And so it didn't come to pass. We hope it won't come to pass this year. We don't think it will, but we really have to, push back and help Congress understand the importance of these prevention programs and why it would be untenable to consolidate and cut these programs. And so that's the CDC Injury Center. One other thing on that previous slide was that we saw last year too that you saw we shared priorities in the Office of Family Violence Prevention and Services. Several of us had been funded as sexual assault resource centers by OFIPS, and that funding, as well as funding for culturally specific programs, was eliminated last year at OFIPS. So that was also a really concern. Okay, so we talked about DOJ, we talked about HHS. We also we talked earlier in our survey about the fact that we know that the housing needs of survivors are really a big deal. And so we also are looking at some priorities at HUD, the U.S. Agency for Housing and Urban Development. And we have several priorities there. We, within the Continuum of Care program, which is the main national response to homelessness, there are bonus funds for serving survivors of domestic violence and sexual assault. So we are requesting $75 million of those bonus funds. We're also requesting an increase of funding for the Office of Gender-Based Violence at HUD. That was an office created in the last reauthorization of the Violence Against Women Act, and a really important source of leadership around gender-based violence issues at HUD, which we know are so important. And then we think it's really important to fund domestic violence and sexual assault technical assistance at HUD. There are a lot of rights in VAWA for survivors of domestic violence and sexual assault, but we know without technical assistance, without implementation efforts, many housing folks don't really know about those protections. And so we really need to do a lot more education and work around implementing the protections in VAWA for survivors of sexual assault. And then we also are looking to the Department of Homeland Security, that budget, DHS budget, to make sure we're providing protections for immigrant survivors of sexual assault. First and foremost, we're asking that no funds are used to apprehend, detain, and remove benefit requesters or beneficiaries of survivor-based relief. So there is relief for survivors of gender-based violence in the immigration system, including the VAWA self-petitioner classification, the T non-immigrant status visa, which is for trafficking victims, and the U visa, which is for victims of crime who are immigrants. It's a way, if they're cooperating with law enforcement, that they can seek legal status. And we really have seen a lot of those folks being detained and deported, and we really think that it's important that immigrant survivors are protected. We also think it's important to gather data about asylum seekers who may be seeking asylum in our country based on their experience of gender-based violence in their home country. And we also know that there is just a huge waiting list and backlog for U visas, and that the first several years of the U visa program, those U visas weren't really used. And so we feel like those could be recaptured and used to help survivors of sexual assault find status to pursue accountability for those crimes. So those are the issues that we're looking at in terms of support of immigrant survivors. There's a lot more, but those are sort of the top line ones. So that, and then one more thing we're working on is Virginia's law, which is legislation that's been introduced in both the House and Senate. It's named after somebody who was harmed by Jeffrey Epstein, survivor Virginia Giuffre, who may have read about. This bill was introduced in 2026, and it's a bill designed to eliminate the statute of limitations for adult survivors of childhood sexual abuse and trafficking to bring civil claims against abusers, so that even if it happened many years in the past, they could still bring suit. So we think that's really important. We know a lot of states are working on that issue as well. So I know that was a long list. Those are our priorities for this year. So we talked about VOCA, the Crime Victims Fund Stabilization Act, SASP on the DOJ side, and then we talked about RPE. We actually didn't go over the Preventive Health and Health Services Block Grant, but that's also something that we're prioritizing. Then we have our priorities at OFIPS, HUD, and some of the immigration issues we're working on, and then finally Virginia's laws. I know that was a long list, but those are the priorities that we have that we're working on this year. And I think that brings me towards the end of the content I wanted to present. Maybe we can have a little more interaction if you all are up for that. So appreciate your attention. I know I can be a little bit of a fast talker. I hope that wasn't too fast, but I wanted to ask you, what is one advocacy related action that you can commit to doing during this month? I know we're getting toward the end of April, so it doesn't necessarily have to be in April, but I'm curious if there's anything that you might have been inspired to do as a result of hearing about these priorities, or something at the local level that you're engaged in, or at the state level, something that you're thinking about, like, I think I could talk to a policymaker about this issue, or I feel inspired to bring a story forward about a survivor. Any thoughts about that? There we go. One thing you could do is share on social media about the Crime Victims Fund Stabilization Act, and I just shared a toolkit in the chat that might be useful to you in doing that. I think our last slide is a Q&A slide. So in addition to thinking about what advocacy you might be able to commit to this year, I'm also interested if you have any questions or comments, and you also have my contact information there. But of course, you have great representation at the Indiana Coalition to End Sexual Assault, so you can always go through them to get to me as well. And yeah, just grateful to be with you all. Glad to open it to questions, conversation, anything you all might have that you're thinking about or want to know more about, or anything I went too quickly through too. I'm always glad to return to.
Terri, I'm going to jump in just quickly and say one thing that everybody can do is vote in the election. Indiana has a primary election on the 5th of May. We are a relatively late primary state, but we have some very interesting legislative races as a result of some redistricting efforts at the national level that were unsuccessful here. And some national folks have come in. There's a lot of money being spent, a lot of ads. And so, I interact a lot with our legislators because of my job and also because of my previous professional endeavors. And I know a fair bit about some of these primary elections that are happening. And so I encourage everyone, who's on our call today, or anyone in our movement, to educate themselves on the people who are running for these legislative seats. I think we are going to have some new legislators no matter what, because we've had a somewhat robust retirement environment in our legislative pool in Indiana. I think lots of different reasons, but it seems to be more this year of people who have said they are stepping aside at the conclusion of their term. So one thing that I want us to lean into, certainly as a coalition, but also with our partners who are on the call and others, is education of those new legislators. We know how important it is for new legislators to be given information when they start about what goes on in Indiana and also in their specific communities as far as victim services. And so we're going to do what we always do, which is new prosecutors, new legislators, make sure that they have all the information they need from us about our movement and the work we do and the importance of funding. So everyone needs to vote on May 5th. And after they do, we'll look toward November to see who some of our new legislators are going to be. There will be a number of them. And then I'll be calling on our partners around the state to help us in the education that we're going to be needing to do. And I know that that's an easy thing. It doesn't cost any money. It's definitely something that everybody ought to do no matter what. But that's just something I want to.
Such a good point, Beth. And certainly the redistricting in many states, but definitely in Indiana, the redistricting issues certainly made national news. I will also say too, I'm so glad you raised the voting issue because Get Out the Vote is something that nonprofits can completely engage in. You can even have register to vote information at your programs and encourage survivors to, and people that you're working with in prevention to register to vote. That's absolutely a wonderful way to be engaged in policy. And I'm so glad you raised that. It's something we talk about in the toolkit, but I didn't particularly put a fine point on it. But yeah, really, really important part of engaging, Beth, is to vote and encouraging others to vote. And it's a completely allowable thing to do too.
Terri, can I ask you to unpack a little bit more about Virginia's law? I've been engaged in Indiana in some statute of limitations related issues. We have a very defense focused statute of limitations environment in Indiana. I've been a lawyer for a long time, and we have just not made any headway at all in getting extensions or expansions in the civil context. Now, we've done some things in the criminal context. I have my own sort of philosophies about all of that as a former prosecutor, so setting aside the criminal context and now focusing really on the civil context, something that really the Epstein situation has really highlighted for a lot of us, and that these, trauma is not linear, right? And so I heard some statistic once that something like 70% of child sex abuse survivors don't disclose until they are adults, many way into adulthood, right? Like tell no one until their 30s or 40s when they were abused as children. So it's certainly a real thing to approach that and seek help through the courts. So what Virginia's law, help me know a little bit more about what it would do on the national level.
Yeah. Some states have had success in this, others haven't. There's definitely can be pushback both, and you made a really important distinction, Beth, between, criminal statute of limitation and civil statute of limitation. People know, and, with the criminal statute of limitation, that's your ability to be prosecuted criminally, and then the civil is like your ability to sue somebody about it. And when I first saw a big wave of work around civil statute of limitations was honestly when a lot came out around abuse in the Catholic Church and other systems. I mean, one of the things that you see with these civil cases, right, for lawyers to take cases to sue unless there's somebody with money, but it can be such an important part of accountability too, right? So when there is a concern about, what's going to be the financial impact, or there is somebody where there is money involved, it can be such a powerful thing. And just as you say, I mean, so many survivors, it takes them years to connect the dots between what has happened to them and, the harm that's caused, and thinking all that through, having the support they need, deciding to come forward. And oftentimes, as we know, survivors will be like, see other people being harmed and be like, I have to do something about this. So it's been an important tool. I know in some states too, like they've opened up, this is not what Virginia's law does, but opened up windows. Like they've said, like, okay, you can have different ways, like 7 years past adulthood, or open up a window where if you didn't bring a case, you can bring a case now. This is really just straightforward, does away with the statute of limitations in civil cases. And I'm not a I need to study it a little bit more. It's also beginning days of this legislation. I'm hoping it'll become more bipartisan. I'm thinking it would be federal, obviously, because it's federal legislation. So much important work on this issue happens at the state level. But certainly there are federal cases, and when anything crosses state jurisdiction. It's also one of those pieces of legislation similar to HIPAA, in that it's an important piece of messaging legislation. It's supported by people that have been harmed by Jeffrey Epstein, an important way to keep talking to Congress about the importance of accountability and doing something about this.
And of course, when we're talking about Congress, accountability starts at home.
All right.
In the two very recent situations where members of Congress were, I guess the spotlight was turned on their behavior, and both resigned, from Congress.
Yeah.
So I think it's, an important.
I haven't tracked this yet, but I saw that there was an initiative. I don't know if she filed a bill or not, by Representative Nancy Mace, who I believe is from South Carolina, related to divulging all of the sexual harassment claims by staff over the years. And it's strange how these things will come around. Like I remember maybe it was 10 years ago or something, there was some move to really good at this issue of, Congress as a workplace and all the
Mhm.
sexual harassment that has happened there, but another move to do that as well. And there may have been legislation filed, but I would need to do more research on that.
Yeah.
But you're
Yeah.
absolutely right. The accountability does start right where we are.
Yeah. Yeah. There was a really good press release and some data from the Sexual Violence Resource Center that was just released, I think, last week about this issue of our government legislative environment, both the state and the federal level, because it's a function of a workplace, but it's also a power dynamic. Like we know so much with these issues is that you know it's about power and control, right? And the most powerful people in many contexts in our country, our elected officials who have a lot of discretion about the way that they run their offices in Congress, and that's true at the state and even the executive level. So it becomes a really ripe environment for abuse. What we
Yes.
see. So
Yeah, and one of the things that has been so interesting to me, I mean, we saw this a lot in the survivors that came forward around the, big New York Times expose around Cesar Chavez.
yes,
And I think about this in the context of like Swalwell's campaign for governors. Oftentimes, these people really believe in the work that they're doing. It's really, I mean, the work is really important. And that, in addition to, Beth, you named the power imbalance as being the most important dynamic, but also like I feel like just such tremendous compassion for people that are doing this work because they believe in the vision of the principle.
mm-hmm.
And that it can also have a silencing impact, I think, too, and like they want
Yes.
that work to flourish and continue, and yet we know that we can't have the goals of having a better society when at the roots these sorts of abuses of power are happening. But that makes it all the more heartbreaking to me.
Yeah, no, that's absolutely true. It's beyond the scope of what we're talking about here, but there's a very interesting documentary. Can we talk about Bill Cosby, right? The notion of separating the good work of people and the movements they're involved in, and then their sort of personal failings, right? And Cesar Chavez is a great example of the people who were abused in that context, but really believed in what he and the rest of the people, the movement, were trying to do. It's not an excuse, of course, but what it is a perpetuating feature.
It makes it more complex for survivors in
Right.
figuring out how to come forward and how to resolve all those issues.
Right. Oh, that's true.
Well, I so appreciate the work everybody does every day. I appreciate being connected. It's always just a treat for me to get to actually talk with the grassroots where I came from and where the most important work is happening.
Yeah. All true. All right. Well, if there is no one else who wants to jump in, I just want to say thank you to you, Terri, not just for being with us today, but for everything that you're always doing to keep this issue front and center and to hold people accountable. I also want to tell everyone Happy Sexual Assault Awareness Month. It is a month when we do shine the spotlight on these issues, and it is an extra effort. And I know that in the face of everything else that's going on, but it is gratifying to see, as frustrating as it is to see these national things happening. It's also gratifying to see people paying attention and thinking it is newsworthy and worth talking about. And that's really due to the hard work everyone's doing every day. So thank you all so much. Terri, thank you. It's good to see you, and take care of yourself. And we'll be talking soon.
So
Thanks,
good to be
everybody.
with you. I appreciate y'all so much.
Take care.
Take care.